Hello,
Hi,
my name is Mansi Gawali, one of the medical student. What is your name?
Sunita Madhukar बोल
Okay. And what is your age?
42.
Okay. So today we are going to do examination of your cranial nerves. For examination of cranial nerves, we will need necessary equipments like a tuning fork, tongue blade, otoscope light, cotton, toothpick, and red topped pin. So now we'll proceed towards the examination.
For cranial nerve 1, that is olfactory nerve, test the sense of smell by presenting the patient with familiar non-irritating odors. First, make sure that each nasal passage is patent by compressing one side of the nose and asking the patient to sniff through the other. Then, ask the patient to close both eyes. Occlude one nostril and test smell in other with substance like cloves, coffee, soap, or vanilla. Normally, the patient perceives odors on each side and identifies them correctly. For cranial nerve 2, that is optic nerve, test the visual acuity. To test the acuity of central vision, use a well-lit Snellen chart if possible. Position the patient 20 feet from the chart. Ask the patient to cover one eye with the card and read the smallest line of print possible. Test visual fields by confrontation. The first one, static finger wiggle test. Position yourself about an arm's length away from the patient. Close one eye and have the patient cover the opposite eye while staring at your open eye. Place your hands about 2 feet apart out of the patient's view, roughly lateral to the patient's ear. While in this position, wiggle your fingers and slowly bring your moving fingers forward to the patient's center of view. Ask the patient to tell you as soon as he or she sees your finger movement. For kinetic red target test, facing the patient, move an 5 mm red topped pin inward from beyond the boundary of each quadrant along the line bisecting the horizontal and vertical meridians. Ask the patient when the pin first appears to be red. For cranial nerve 2 and 3, that is optic and oculomotor nerve, inspect the size and shape of the pupils and compare one side with other. Also check the near response, which tests pupillary constrictions, convergence and accommodation of the lens. For cranial nerves 3, 4 and 6, that is oculomotor, trochlear and abducens nerve, test the extraocular movements in 6 cardinal direction of gaze and look for loss of conjugate movement in any of the 6 directions. Check the convergence of the eyes. Identify any nystagmus, an involuntary jerking movement of the eyes with quick and slow components. Look for ptosis. For cranial nerve 5, that is trigeminal nerve, while palpating the temporal and masseter muscle, in turn, ask the patient to firmly clench the teeth. Note the strength of the muscle contraction. Ask the patient to open and move the jaw from side to side. This work for motor part. For sensory, test the forehead, cheeks and chin on each side for pain sensation. The patient eyes should be closed. Use a suitable sharp object such as pin or cotton swab. You can create a sharp wound splinter by breaking or twisting the cotton swab. To avoid transmitting infection, use a new object for each patient. While testing occasionally, substitute the blunt end for point as contrasting stimulus. Ask the patient to report whether the stimulus is sharp or dull and compare the sides. If you detect sensory loss, confirm it by testing temperature sensation. Take 2 glasses filled with hot and ice cold water. Touch the skin and ask the patient to identify hot or cold. Then test for light touch using a fine wisp of cotton. Ask the patient to respond whenever you touch the skin. For corneal reflex, ask the patient to look up and away from you and approach from the opposite side out of the patient's line of vision. Avoiding the eyelashes, lightly touch the cornea with fine wisp of cotton. Inspect for blinking of both eyes, the normal reaction to the stimulus. Cranial nerve 7, that is facial nerve. Inspect the face both at rest and during conversation with the patient. Note any asymmetry often visible in the nasolabial folds and observe any tics or other abnormal movements. Ask the patient to raise both eyebrows, frown, close both eyes tightly so that you cannot open them. Test muscular strength by trying to open them. Show both upper and lower teeth. Smile. Puff out both cheeks. Cranial nerve 8, that is acoustic and vestibular nerve. Assess hearing with the whispered voice test. Ask the patient to repeat numbers whispered into one ear while blocking or rubbing your fingers next to the contralateral ear. If hearing loss is present, determine if the loss is conductive from impaired air through ear transmission or sensory neural from damage to the cochlear branch of cranial nerve 8. Test for lateralization, that is Weber's test. Place the base of lightly vibrating tuning fork firmly on top of the patient's head or on the mid-forehead. Ask whether the patient hears the sound on one side or both sides. To compare air conduction and bone conduction, use Rinne test. Place the base of lightly vibrating tuning fork on the mastoid bone behind the ear and level with the canal. When the patient can no longer hear the sound, quickly place the fork close to the ear canal and ask if the patient hears the vibration. Here, the U of the fork should be placed forward, which maximizes sound transmission for the patient. Normally, the sound heard is longer through air than through bone. For cranial nerves 9 and 10, that is glossopharyngeal and vagus nerve, listen to the patient's voice. If there is difficulty in swallowing, ask the patient to say ah or to yawn as you watch the movements of soft palate and the pharynx. The soft palate normally rises symmetrically, the uvulae remains in the midline, and each side of the posterior pharynx moves medially like a curtain. Warn the patient that you are going to test the gag reflex, which some patients may refuse. This reflex consists of elevation of the tongue and soft palate and constriction of the pharyngeal muscles. Stimulate the back of the throat lightly on each side in turn and observe the gag reflex. Cranial nerve 11, that is spinal accessory nerve. Standing behind the patient, look for atrophy or fasciculations in the trapezius muscle and compare one side with the other. Ask the patient to shrug both shoulders upwards against your hands. Note the strength and contraction of the trapeze. Ask the patient to turn his or her head onto each side against your hand. Observe the contraction of opposite sternocleidomastoid muscle and note the force of movement against your hand. Cranial nerve 12, that is hypoglossal nerve. Listen to the articulation of the patient's words. Inspect the patient's tongue as it lies on the floor of the mouth. With the patient's tongue protruded, look for asymmetry, atrophy, or deviation from the midline. Ask the patient to move the tongue from side to side and note the symmetry of the movement.